Hi, this is Stephen, and in this video we will continue our discussion of parameters used in diastology, or how the heart fills with blood. And in this one we'll look at pulmonary vein Doppler tracings, a topic that can sometimes be a bit confusing. And let's do our best to tackle that. So here's our left atrium, emptying blood into the left ventricle via the mitral valve, our right ventricle and right atrium. And our pulmonic veins are, maybe we'll have one up there. There's typically four pulmonic veins, right? And you may or may not see them clearly, but they'd be somewhere around there. And blood flows in the pulmonic veins. During systole, it fills up the left atrium, and then during diastole, it continues to flow into the left atrium, and it'll pass right through, actually, all the way then into the left ventricle. During the atrial kick, you may see a little bit of blood flow that bounces back. And so let's draw that. I'm going to clean up that last. Let's see what those graphs would actually look like and try and understand. So you have we're measuring our pulse wave Doppler. Let's say we're measuring right about there, or we're measuring it, or we could be measuring it right over here, whichever pulmonic vein you can get a good picture of. And what do we see? Well, we'll see something like this. And actually, just for comparison, I'm going to also superimpose the E and A waves that you may be familiar with, our inflow right at the mitral valve. So in a normal scenario, we've got our early and then our late flow of blood through the mitral valve. And what do we see on our pulmonic trace? Well, we'll see in systole, we'll see blood that's flowing into the left atrium, and then during diastole, we'll see some more blood that's flowing into the left atrium. And then we'll see the atrial kick, where some blood bounces back towards or actually like flows backwards from the left atrium into the pulmonary veins. Remember, the goal is most of it go forward, but some may go backwards. This would be normal. And what if we have impaired relaxation? Well, with impaired relaxation, you've got your A wave, and then your E wave, and then your A wave. And actually the atrial kick is providing more of the blood flow into the left ventricle. And again, you'll see in systole, blood will flow into the left atrium, and then in diastole, typically a bit less blood flow will come into the left atrium, and it'll pass right through into the left ventricle. And then during the atrial kick, again, you'll see blood flow reversing. That would be impaired relaxation. And what happens as you start to get elevated left ventricular filling pressures? Well, that's where you start to see this pseudo-normal pattern where blood is getting pushed from high pressures in the left atrium into the left ventricle, and that's where the pulmonic venous Doppler is helpful. So then what you'll see, and I realize I should have been labeling these, so let me just on top, this is the E wave, and the second wave is always going to be the A wave. For the pulmonic valve, we have the S wave that comes during systole when we don't see any flow on the mitral. There's nothing that corresponds on the green. And then our D wave during diastole, the D and the E are during the same time, and then we'll call this our A reversal. And then let's just label these as well so it's easy to follow. Now you'll see again blood flow comes into the atrium during systole, but you'll see during diastole, when the valve is open, that's actually when you see most of the blood flow leaving the pulmonic veins, and it goes through the left atrium where there's a lot of pressure built up, and it kind of shoots into the left ventricle. It's more of a push than a pull, and you'll see that atrial reversal down there. And similarly for the restrictive flow, so let me label this. This is the pseudo-normal pattern we said, pseudo-normal. And then we said down here, you've got your restrictive pattern where the E wave is really tall, much taller, more than double the height of your A wave. And same thing down here with pulmonics, you'll see that You have a bit of flow in systole, but most of the flow from the pulmonic veins into the left atrium and then go straight into the left ventricle is during diastole, and then a large atrial reversal there. So the S wave, the D wave, AR wave, S wave, D wave, and AR wave. And you see how in each of these, your E wave and your D wave are kind of, it's two ways of looking at the same thing, right? The blood that flows in during diastole into the left atrium, that's the same blood, unless it's going somewhere else, like through an ASD or something bizarre. That same blood then rushes in through the open mitral valve into the left ventricle. And so if we draw a line right here, oh, apologize, let me label. So this was restrictive filling, restrictive filling. And so if I'm going to draw a divider here, because these ones down here are all the ones with elevated left filling pressures. And what you'll notice is that when we see that the D wave of the pulmonic valves, when we see that the D wave is bigger than the S wave, either bigger in height, or you can look at the area under the curve, and it's like at least a 60-40 split, with 60% being under the D wave and 40% or less being under the S wave. When you see a pattern like this, that tells you, as long as this is a abnormal heart with reduced ejection fraction, that suggests that you have elevated left filling pressures. Now, back in a previous video, we talked about E over E prime. That's a very useful way to estimate filling pressures, whether it's a normal heart with normal ejection fraction or an abnormal heart with reduced ejection fraction. This is specifically elevated left filling pressures in an abnormal heart with a reduced ejection fraction. So pulmonic veins, if you're able to get them, if you're able to get these traces, one more tool that you can use. So we've got the mitral inflow, we've got the tissue doppler that can help us sort out this normal versus pseudo-normal. We've got the Valsalva maneuver, and then one more trick that we can do here, looking at the blood flow from the pulmonic veins. When you see a D wave, you see in diastole, there's more blood flow rushing through the left atrium than that which fills it during systole. That's abnormal, and that can suggest elevated left-sided filling pressures.